There's no doubt the pandemic has been tough on mental health, but one local researcher found a positive COVID diagnosis can lead to drastic effects on mental health. 5 on your side, Sarah Maki talked to him about his research, plus a local psychiatrist who was offering a new solution.
This is a much bigger problem than we expected.
Washington University clinical epidemiologist Dr. Ziyah Al-Aly recently crunched the numbers for a new study in the journal The BMJ. He found people who had COVID-19 were 60% more likely to suffer from mental health problems than those who were not infected. Hospitalization jumped that number up to 86%.
Do we know why?
COVID-19 can enter the brain and can also lead to alterations in brain chemistry and brain architecture that may affect mood centers and affect centers, the areas in the brain like the amygdala and other areas that are responsible for us feeling good and feeling content and feeling happy.
I'm not at all surprised.
Clayton psychiatrist Dr. Dale Anderson says he's been spending a lot of time with patients working through pandemic-specific problems.
I always have people fill out forms before their visit to give me a quantitative idea of where they are in terms of depression and anxiety.
To help, he created a program online called Kapow, a combination of cognitive therapy and power, signing up more than 400 people, teaching them ways to focus on what they can do to be proactive instead of coping through negative or harmful methods.
There are some times where people will self-medicate with alcohol or self-medicate with drugs, and it's caused overdoses and it's caused all sorts of problems for people, and there's help available.
Dr. Al-Aly says that's one of the biggest takeaways of his study.
To nip it in the bud, to sort of prevent it from becoming a much more serious problem down the road.
Because the increased risks to mental health are coupled with increased drug, alcohol, and opioid use, and an increased risk of suicide. In St. Louis, Sarah Maki, 5 on your side.
If you are struggling with your mental health, there's a 24/7 hotline at 1-800-662-HELP, 1-800-662-HELP. And for links to the doctor's research or the Kapow program, look for this story on KSTK.com under the As Seen on TV section.